Something that I've been working on a lot recently is how experienced patients and healthcare staff move into talking about difficult and potentially distressing topics, such as how long somebody has left to live, or about the dying process itself. And by looking at this, we can come up with important understandings of how people can move into talking about these difficult issues and how we can do that in our own personal or our working lives. I want you to imagine a conversational space in which we talk about death and dying. And I want you to imagine that there's a door into that conversational space. Now, one way that we could move into talk about difficult issues is to just barge in, just go straight in, straight to the point. But what we see in my own research and lots of other people's research is that usually people don't move into this topic so directly. They go step by step and they go gently. One way of going in gently is to provide opportunities to talk about the difficult issue. So I want you to imagine that you're sitting with a friend or a relative and they've been talking about someone they're close to that's died recently. You can give them the opportunity to talk about their own dying, saying something like, "Does that make you think of you?" You can also provide opportunities by raising things like a book or a TV programme that you've been reading or looking at. Something that's really useful about providing opportunities to talk about dying is that it doesn't force the issue if the person's not ready. Even if the conversation doesn't happen, then it's kind of planted a seed, and also you've shown that person that you are ready to talk about the difficult issues. Sometimes there are good reasons for pushing a bit harder on that door. For instance, somebody has had a diagnosis of a serious illness or is becoming more frail and unwell. One way of pushing harder on that door is to ask a hypothetical question. By hypothetical questions, I mean talking about a future scenario, such as somebody's illness becoming much worse, and then asking the person what they would want. My name's Ruth Parry and I'm a Professor of Human Communication and Interaction at Loughborough University.